Welcome to our 5 on 5. We're pleased to welcome back Dr. Jim Shames, the Medical Director for Jackson County Health and Human Services. Dr. Shames, good to see you again. How are you?
Good to see you again, too. I'm doing well.
Excellent. So you guys have been very involved in starting the Oregon Pain Guidance Group, and this week President Obama declared this Opioid and Heroin Awareness Week.
Yeah.
This is obviously something that is a huge epidemic nationally. Right. Where are we at locally with curbing some of these overdose deaths and these types of drug interactions that people are having?
Well, we're very involved locally. We have lots of different programs in action all at the same time. This is a really big issue. We have overprescribing of opioids. We have lots of people who are taking high doses of pain medicines, people who are taking them inappropriately, and of course we have people who are addicted to heroin. In order to solve this problem, we need to come together as a community, educate ourselves, establish some clear guidelines for appropriate actions. That's sort of the upstream piece. Downstream, we need to make sure that naloxone is available to save people who are overdosing on opioids, and then everything in between.
And it sounds like now those are supposed to be available in pharmacies for you or I without a prescription. We can go get those.
That's right. Pharmacies can provide a small amount of education that's necessary, and they can give you the drug.
Wow.
And
saves lives, quite literally.
It saves lives. A number of our local law enforcement are carrying naloxone, and they've saved people already. Substance abuse treatment providers are providing naloxone. Some providers are prescribing it when they prescribe opioids, just to be sure the family knows that they can keep their loved ones safe.
Wow. Okay. So when exactly did Oregon Pain Guidance get started?
Probably about 6 years ago. I've kind of lost track
okay.
exactly.
Yeah, it's all right.
Yeah, but it's been an evolving community effort. We bring together people who prescribe, behavioral health, substance abuse, insurance specialists, we pharmacists, and we all sit down in one room once a month, and we hash out what are we going to do as a community, what are the best practices that we want to adhere to, how do we reach out to our colleagues, and stay in touch with others that have more information than we do. How do we educate ourselves as well?
Very good. All right, we're going to take a quick break. Much more in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Dr. Jim Shames, the Medical Director for Jackson County Health and Human Services. Talking, of course, about Oregon Pain Guidance and everything happening with opioids and heroin that you guys have been trying to curb, Dr. Shames. So tell us about how big of a public health issue that stuff really is right now.
It's really one of the biggest public health issues that we have. More people die in this country from accidental overdoses than die from motor vehicle accidents. And that's been true for the last 6 years. Wow. Certainly true in this county. So it's a big problem. It has lethal consequences, and we really need to be putting lots of effort into solving it.
And you talked about how many meetings you guys have with these prescribers, with these medical doctors who prescribe opioids perfectly legally to patients in pain. How difficult is it for you and the people with Oregon Pain Guidance to almost retrain them on the dangers of prescribing these strong, powerful drugs?
Right. Well, we had decades of influence by major pharmaceutical companies to convince us that we had a new chronic problem called chronic pain, and that there was a safe solution called high-dose opioids. And that turned out not to be true. But, it's a hard lesson to unlearn that these medicines actually do not do a very good job treating chronic pain. They're excellent for acute pain. But for back pain that you have every day, these medicines wear off in their effectiveness. They have high risk of overdose and lots of side effects. So we have to kind of walk that back. We have to all unlearn it. The doctors have to learn what the latest evidence suggests. Patients need to learn that they're heading into trouble as they take ever-increasing doses of opioids on a daily basis. So it's difficult, but we can do it.
Certainly, and as I understand, you were telling me during the commercial break that people, the drug is so powerful that they're in almost in physical pain, or maybe they are in physical pain, as they're trying to get off of it.
Exactly. You don't need to get in trouble with the drugs. Just if you're taking them on a daily basis at relatively high doses, you will get very sick when you try and stop them. Your pain will increase. It'll be almost uncontrollable. So it stands to reason that people will feel like I need more pain pills because look how much pain I have when I try and stop them. But that's withdrawal, and that most people will do better off of the opioids and learn new coping strategies to manage their pain.
Wow. All right, so my last question, it seems like this sort of educational program you guys are involved in is really without argument. What makes progress so difficult?
I think what makes it difficult is the powerful hold that opioids have on people, and then perhaps a lack of understanding at all levels, including the providers, that these drugs are potentially quite dangerous and they're not very beneficial in chronic conditions. I think what makes it difficult is for people to learn the facts, to learn how the medicines really work, and to start trusting that people can manage this problem in other ways.
Wow. It's good to see you. Thanks so much for being here. Appreciate it. All right. Stay with us. We'll be right back.